Our first speaker is Andria Ventura. She is the Legislative and Policy Director at Clean Water Action. She left a corporate career in publishing in 1995 to join Clean Water Action's New Jersey chapter, working on drinking water, pollution prevention, and source water protection. She joined the California Clean Water staff in May 2003. Oh boy, that just disappeared.
Sorry, Lenny, that's me. I just put my screen up. That's okay.
In May 2003, and represented the Clean Water Fund on the Environmental Justice Coalition for Waters Program Advisory Committee, the Change Coalition, the Biz NGO Policy Work Group, and the Safer Streets Coalition working on toxics. Key areas of Andria's work include developing beneficial uses of water to protect tribes and subsistence fishers, surface water cleanup and protection, drinking water contaminants, and chemical policy. Welcome, Andria.
Thank you, Lenny, and it's great to be here. Today, what I'm going to be doing, I'm not a physician and I don't have a medical background, so I'm going to be giving folks a little bit of a sense of what's happening with PFAS in California. You've heard a little bit about it from others, particularly Martha, and I want to thank her. But I do want to start by personalizing this just a little bit, maybe adding a minute to my presentation because of some of the things I heard. I've been doing environmental advocacy, particularly around water, for over 30 years. And it has been very hard to work with the medical community to try to make the connections regarding health and the environment for a very long time, to engage with the medical community, because there seems to be a fear or a lack of desire to be advocates as much as trying to treat people. And so I'm glad to see this sort of forum happening so we can bring that to the fore. I'm also a patient. I have had a panoply of chronic disease and illness over the years, and I have never been asked about my toxic exposures. I have had to bring them up to my own physicians. And I do live in an area that was impacted by PFAS in our water system. I'm lucky I live in a city where we could take those wells offline, but we have no idea what that has done to our health in this city to date. So I really want to thank some of the previous speakers who spoke from that perspective and bring that into play. But knowing what's going on with our water and some of the other efforts in the state is going to be very important to physicians, and particularly water, which is not only my knowledge area, but because water actually makes up several exposure routes to the public. Obviously, drinking water is a clear connection of how people are exposed to PFAS and other contaminants. But also when our surface waters are contaminated, PFAS move up the food chain, and we're at the top of that food chain, and people fish out of our waters in California. And crops that are fertilized with PFAS laden sludges from wastewater treatment plants that can't get these chemicals out, or irrigated with PFAS waters are also impacted. Now, first things first, I want to really drive this home. When I'm talking about PFAS, I am talking about PFAS as a class. According to the US EPA, there are actually 9,000 of these chemicals, and I apologize for the noise behind me. It really, to me as an advocate, I don't care which PFAS we're talking about. They are all, according to independent scientists, persistent, accumulative, mobile, and to one degree or another hazardous. And even despite claims by the chemical industry that some of them, the newer versions of these chemicals, are not as toxic or pass through the body, while that's not actually panning out by the science that they are toxic, they also tend to break down into the PFAS that we know a great deal about. And so we really need to be thinking of this as a class of chemicals. Not only is the science showing that, and these chemicals are that class that I call PFAS, not only as we study these chemicals are we being able to fill in the X's of these health impacts that we see in the better known PFAS chemicals, but as brought up, actually Lenny just mentioned it, we expect to see additive or synergistic effects that we really do not understand yet, but is something that obviously doctors are going to need to be aware of and be interested in. What happens when most of us are not exposed to one or two PFAS. They're ubiquitous in the environment and they're ubiquitous in products and workplaces. Consequently, we are getting cocktails of these chemicals, and they are also mixing with other chemicals that we are exposed to. And as I said before, some of the newer chemicals or alternative PFAS chemicals to replace the well-known ones that we learned about in dark waters, for instance, are showing up as toxic as well. So that's why I make that point. So where are we in California? I don't have the time to go through a lot of detail about how we didn't do anything for a long time, even though national monitoring data that was very limited to 6 PFAS and to major water systems in 2012 and 2015 showed that California had the most detections in its water in the country. We really weren't doing much until about 2019 in the state. However, the state has started a phased monitoring of drinking water. And by that, I mean they're looking at the drinking water sources that the federal government, the federal monitoring program did show were contaminated, and then they're pushing out from there. They're also looking at specific sites where you would expect to be sources of PFAS, landfills, wastewater systems, metal planing facilities. This is kind of guesswork. This is what we know where sources would be. The ones in red have already started monitoring, and in those cases, they're monitoring both groundwater at those sites and soil. And then we're looking at water systems that are around those, and we continue to push out and look further and further until we don't see PFAS. Not a very common experience. We are seeing, the more we look, the more we're seeing. The problem with this phased approach, it's a good approach in that we're getting data, but the problem is that where that leaves us with, after about 5 quarters of data collection, we've only tested 3% of the water systems in the state to date. Now that does capture a lot of the population because we're looking at the biggest systems in particular, but millions of Californians are affected by water served by small systems in disadvantaged communities that are either not being looked at or are being skipped over, or they are dependent on domestic wells, which we're not looking at all. And that gets to the point that Marta Arguello made earlier, that where are people living? What do we know about their water? Do we know anything? Or do we know it's contaminated? And how do doctors react to that? How do doctors figure out what they need to be asking people? This is a major problem. We would advocate that the state needs to at least once do a full panoply of testing across the state, particularly at least at public water systems throughout the state. And we have initiatives to try to promote that. This is just a map of suspected sites, so you can see that it's a statewide phenomenon. Now, despite those limitations, we do have a fair amount of information coming in to show that we have a pretty catastrophic problem in the state. First of all, we have found that even with that 3% of the water systems, we have found detections of PFAS in water sources meant to serve 13 million Californians, which means either millions of people are drinking this contamination, or we are losing water sources as those wells are taken offline, as was done in my own community. We are also looking right now for 18 PFAS chemicals in water. That's based on technological limitations. We have found 9 of them throughout the state. So again, we need to look at this as a class because we're starting to see indications that there are more than that. And we're pretty confident that as testing continues, we're going to find more and more different types of PFAS. One suggestion that we have made to the state is to look at total fluorine to try to get a better sense of just how much the problem is, even if that doesn't tell us what the specific chemicals are. I'm not going to talk about the regulation of PFAS because of limitations on time. but to say that it is very slow in California. Notification and response levels, which I can explain if people have questions on, are not enforceable rules, and we only have them for 2 chemicals. And the state is really only looking at PFOA and PFOS for regulation that can take over a decade. But in the sense of doctors and what else we need to be looking at, there are also some missing links that we need to understand better. One is, what about surface water? Most of the testing that's going on is really focused on wells throughout the state, but we do drink surface water in this state. But also, our surface waters are areas where people are fishing. San Francisco Bay, for instance, has some of the highest levels, if not the highest levels, of PFOS, the chemical PFOS, in its wildlife in the world. And yet people are fishing out of that water body all the time. And I'm not just talking about sports fishers. I'm talking about subsistence fishers, something that is very hard to quantify. But we know there are high levels of subsistence fishing in the bay, and we would expect this to be true throughout the state. Some of these fishers are fishing out of economic need. So they're low-income communities, and some are fishing out of cultural tradition. So we're targeting our communities of color. And then, of course, what is happening to our agriculture when we're spreading sludge from wastewater systems or irrigating with contaminated water. So I do want to speed this up a little bit and tell you one other effort in California is the biomonitoring program. And biomonitoring in California is a collaborative effort of agencies in California to determine levels of environmental chemicals and a representative sample and trends of the impacts. And these are just 4 that have looked at PFAS. But and you can look at the details of these and the specific findings of these. I provide links at the end of the presentation. But what's important about this is that we're looking at particular impacted communities. The Asian Pacific Islander community looked at Chinese residents of San Francisco and Vietnamese residents of San Jose, where I live. And they did find elevated PFAS, potentially from fishing practices, but we're not sure. The teachers studying the firefighters' occupational studies found elevated levels in both teachers and firefighters, showing links to the ways people make a living. And then the California Regional Exposure Study is a multi-year study that is measuring PFAS across ethnic, racial, and economic levels throughout the state. Early indicators in Los Angeles and Southern California have shown very high levels of PFAS. In some cases in 90% or 100% in this one case of people being studied. So again, this gets back to the point of people, physicians needing to understand the cultural dynamics going on, the ways people are making a living, and their regional exposures, which gets back to some of the other things that people have said before me. I'm not going to talk about some of our source reduction efforts here because of time, but I will end with, what do we think we need? We need greater understanding of the scope of the problem for all PFAS. That certainly includes more environmental monitoring, water monitoring, soil monitoring, etc. We need to understand how people are being exposed through the products, workplaces, what they eat, and who is the most impacted. Are they the low-income communities of color, as we expect to see the highest levels? Where are the synergistic effects? And also looking for PFAS in the body. Blood serum is the traditional way of looking at it, but there's some evidence that short-chain chemicals may actually collect in organs or other parts of the body. So how are we actually looking to see, how are we biomonitoring? And finally, we need better public understanding of the health effects. You heard people who are living in affected areas speak to that much more eloquently. Who is the most impacted? Why? We need multilingual, multicultural understanding and outreach to engage people in biomonitoring and medical care. We need people to have solutions Don't just tell them they have a problem, but give them ways of avoiding these chemicals. Very hard, they're ubiquitous. But most importantly, we need your help in the medical community to advocate to stop using these chemicals, because we cannot treat our way out of these problems, neither in our water or our bodies. So with that, here are some links that you can look at some of the studies and see the findings. And I will end by thanking you all for listening to me.